My name is Stephanie Norman. Thank you for participating today on my program on child maltreatment recognition and reporting. We will now begin with the presentation. Recognizing and reporting child maltreatment. Why is it important? In order to prevent harm to children, it is important to understand how to recognize and report child abuse and neglect. Reporting abuse and neglect may also assist families in receiving necessary services, or it may help disrupt or terminate a cycle of maltreatment. Child maltreatment is defined as any act of commission or omission by a parent, caregiver, or person in a custodial role resulting in harm, potential for harm, or threat of harm to a minor child under the age of 17. Child maltreatment includes physical abuse, sexual abuse, emotional abuse, and neglect. Herbert Ward once said, "Child abuse casts a shadow the length of a lifetime." The definitions of physical abuse, sexual abuse, emotional abuse, and neglect will be discussed further. Additionally, the indicators for each will be provided. Physical abuse is the methodical use of bodily force against a child, resulting in or potentially resulting in physical injury. It includes hitting, shaking, kicking, punching, biting, beating, pushing, shoving, and dragging. One of the most tragic forms of physical abuse is abusive head trauma, which we will discuss further. The indicators of physical abuse include unexplained bruises, burns, fractures, lacerations, abrasions, human bite marks, bald spots, and rope burns on the arms, legs, neck, and/or torso. Please familiarize yourself with these as they will assist you in the identification of child abuse. Generally, these indicators do indicate that a child's safety may be at risk, and at the very least, the situation should be assessed by a professional able to determine the causes of these symptoms and offer the help and assistance necessary to reduce the risk to a child. Abusive head trauma is often known as shaken baby syndrome and is abbreviated as SBS. It only takes seconds of vigorous shaking to cause life-threatening injuries or death, and it's important to know that shaking is not an accident. It is difficult to know the exact number of SBS cases per year because many cases are underreported and/or never receive a diagnosis. However, a study of North Carolina's shaken baby syndrome cases suggests that as many as 3 to 4 children a day experience severe or fatal head injury from child abuse in the United States. Those infants will suffer from mild to non-acute residual effects and/or neurological damage, such as blindness, seizures, hydrocephalus, hearing loss, cerebral palsy, learning and developmental disabilities, and speech difficulties. Sexual abuse. Sexual abuse is any completed or attempted sexual act or sexual act with a child by a caregiver. It also encompasses exploitation of a child by a caregiver. Sexual abuse often manifests in behavioral indicators rather than physical indicators. Indicators include suicide attempts, poor academic performance, eating disorders, and chronically running away. Emotional abuse. Emotional abuse, also known as mental abuse, is defined as intentional caregiver behavior suggesting to a child he or she is worthless, flawed, unloved, or unwanted. It can either be continuous or episodic and includes terrorizing, berating, and isolating. Emotional abuse ignores the child's developmental needs, thus placing the child at risk for psychological morbidities. Physical indicators include speech disorders, lags in physical development, failure to thrive, asthma, severe allergies or ulcers, or substance abuse. Behavioral indicators include habit disorders such as sucking or biting, conduct disorders, neurotic traits, and behavior extremes. Examples of emotional abuse include recurring incidents of ridiculing, demeaning, and making derogatory remarks. Also, wishing a child had never been born or shunning a child is also indicative of emotional abuse. Child neglect. Child neglect occurs when the parent or caretaker also fails to provide necessary care, which may be food, shelter, medical care, or the parent or caretaker engages in substance abuse and the abuse impacts the care of the child, or the parent or caretaker fails to provide supervision. Each of the types of child neglect will be discussed individually to provide you with a better understanding of each. In the right-hand corner of the slide, you see two images of the brain. The image to the left is the normal brain of a 3-year-old child. The image to the right is a 3-year-old child who has suffered extreme neglect. Please take note of the differences in the brain development. Later on, I will explain how child maltreatment affects the overall health of a child. Child neglect. Physical. Physical neglect is failure to provide the child with physical needs such as nutrition, shelter, hygiene, or clothing. Emotional neglect occurs when the child is ignored or is not provided an emotional connection. Medical or dental neglect is failing to provide the child with access to these services or failing to comply with medical treatments such as asthma medication. Educational neglect is failing to provide the child with federal or state educational requirements. The indicators of child neglect can be physical and or behavioral. Physical indicators include hunger, inappropriate dress, uncleanliness, lice, unattended physical or medical needs, lack of supervision. Behavioral indicators include frequent school absences or tardiness, and constant fatigue. The latest national child maltreatment statistics will be reviewed to provide you with a better understanding of how pervasive child abuse and neglect is nationally. Child maltreatment occurs at every socioeconomic and educational level. It occurs across ethnic and cultural lines and within all religions. In short, child maltreatment does not discriminate. Children in this country are suffering a hidden epidemic of child maltreatment. Every year, more than 3 million reports of child abuse are made in the United States involving more than 6 million children. Every 10 seconds, a report of child abuse is made in the United States. According to the National Child Abuse and Neglect Data System, abbreviated NCANDS, 686,000 of these cases were substantiated in fiscal year 2012. Data suggests Child Protective Services underestimate child maltreatment cases, and the actual number is much higher than reported. Regardless, child maltreatment is a public health crisis. These percentages are calculated against the number of substantiated reports in 2012, which amounts to 686,000. It is important to note a child may see multiple types of abuse or multiple instances of the same type of abuse. As you can see, neglect is the most common type of child maltreatment with 78.3% of cases. Physical abuse accounts for 18.3% of the cases, followed by sexual abuse at 9.3% of the cases. Psychological maltreatment accounts for 8.5% of the cases, and medical neglect accounts for 2.3% of the cases. The United States has one of the worst records among industrialized nations, losing on average 5 children every day, or 1,600 children annually, to fatal child abuse and neglect. Many experts argue the number of fatal child maltreatment cases are underreported and underestimated due to agency mandates, protocols, and practices. A recent report on child abuse and neglect estimates 50% of fatalities reported as unintentional injury deaths are later reclassified as fatal child maltreatment upon further investigation by medical or forensic experts. Additionally, it is reported that as many as 5 to 10% of cases of sudden infant death syndrome could be what is known as infanticide, with abuse or neglect as a contributing factor. The costs of child maltreatment. Estimating the economic burden associated with child maltreatment is significant for several reasons. First, economic estimates increase awareness of child maltreatment. Second, it places child maltreatment in the context of other public health problems. And third, It is useful in the economic evaluation of primary and secondary prevention programs. The lifetime economic burden resulting from new cases of child maltreatment, which includes both fatal and non-fatal, is estimated at $124 billion. Children identified as maltreatment or investigated for maltreatment incurred higher than 2,600 in Medicaid expenses when compared to children who were not identified. Based on calculations by Florence and colleagues, this implies an additional $5.9 billion in costs to Medicaid, which accounts for approximately 9% of all Medicaid expenditures for children. According to the CDC, the estimated average lifetime cost per victim of non-fatal child maltreatment is estimated at approximately $210,000. These costs are similar to other chronic health conditions. For instance, a stroke has a lifetime cost per person estimated at approximately $160,000, and type 2 diabetes is estimated between $181,000 and $253,000 per person. In cases of fatal child maltreatment, the estimated lifetime burden is almost $1.3 million, including $14,000 in medical care costs and $1.25 million in loss of productivity. What remains unaccounted for in these estimates are the emotional costs associated with child maltreatment. Child maltreatment victims encounter pain and suffering, which lead to a reduced quality of life. These emotional losses cannot truly be quantified, but must be considered when discussing the economic burden of child maltreatment. The emotional costs associated with child maltreatment may, in fact, represent the largest cost component and therefore should be taken into account when allocating resources for prevention and treatment. The adverse health outcomes of child maltreatment. Child maltreatment victims are more likely to experience adverse health outcomes throughout their lifespan resulting from neglect and abuse. Experts contend child maltreatment is multi-layered and is associated with poor physical and emotional mental health, social difficulties, cognitive dysfunction, high-risk behaviors, and behavioral problems. Studies like the Adverse Childhood Experiences Study, abbreviated ACE, conclude there is a statistical relationship between the ACE score, which calculates childhood stress, to health and behavior outcomes. In other words, child maltreatment predicts the onset of physical and mental morbidities. It may also lead to premature death. In 2009, Brown and colleagues evaluated ACEs and premature death in adulthood. Brown concluded people exposed to ACEs are at an increased risk of premature death when compared to those without ACEs. The studies showing the relationship between child maltreatment and adverse physical health outcomes are staggering. Child maltreatment increases the probability of hospital-based management for asthma, infection, inflammation. Moreover, child maltreatment substantially contributes to chronic pain and obesity, which persists into adulthood. Additionally, child maltreatment early in life damages the brain by impairing cell growth, interfering with the formation of circuitry, and altering the neural structure and function. In another study, child abuse predicted liver disease related to alcohol use disorders and heart-lung symptoms related to cigarette smoking. Lastly, child abuse and neglect increases the victim's risk for developing diabetes, lung disease, malnutrition, and vision problems. Child maltreatment and mental health. Child maltreatment is directly associated with the development of DSM-IV mental disorders. Child maltreatment is significantly associated with mood, anxiety, and substance use disorders. Additionally, it increases the risk of behavior problems such as anxiety, depression, and aggression. It also increases the risk of post-traumatic stress disorder, which leads to intrusive thoughts and memories, sleep difficulties, and detachment. Lastly, child maltreatment increases the risk of attempted suicide for young adults. Child maltreatment and risky behaviors. Child maltreatment correlates with risky behaviors. Preteen children exposed to sexual abuse engage in overtly sexualized behavior, thus placing them at risk for sexually transmitted diseases, teen pregnancy, and prostitution. Additionally, child maltreatment victims are prone to juvenile delinquency, aggression, violence, and adult criminality. It also places the victim at risk for substance abuse, alcohol abuse, and cigarette use, noting many of these risky behaviors translate into physical comorbidities such as liver disease, diabetes, and heart and lung disease. The military and child maltreatment. In 2013, the Army Times brought this issue to its front page. These are the words of former Sergeant Kevin Randall Hill. She kept crying, and I slapped her across the head, which in turn made her more upset, and then I lost control. I began to shake her. I threw her onto the bed, where she rolled toward the window, hitting her head against the windowsill. I then lifted her up, threw her into her crib. She began crying even more. I dropped her to the floor, and I sat on her. Then I got up and laid on top of her, releasing the full weight of my body on her. She kept crying, so then I picked her up off the floor, placing both of her arms at her side, and bear hugged her very tightly, where her cry became faint. His daughter, Leah, was 5 months old at the time. Leah suffered multiple serious injuries and is requiring lifelong care for her disabilities. Military child maltreatment statistics. Many are unaware of the growing epidemic of child maltreatment in the Army as well as other service branches. Between 2009 and 2012, the Army has seen a 40% increase in child abuse cases. Prior to 2011, the rates of child maltreatment were lower within the military population when compared to the civilian population. However, after 9/11 and the increase in combat deployments, the rates of child maltreatment have doubled. Some studies suggest the rates of child maltreatment in the military are increasing at a much faster rate than predicted and therefore exceed the civilian population. Moreover, research suggests military communities have documented elevated levels of fatal child maltreatment and shaken baby syndrome. The rate of occurrence of child maltreatment was twice as high during operational deployments. Additionally, researchers examined patterns of spouse abuse and child abuse, which has a strong correlation. When spousal abuse and child maltreatment were identified together within the same family, the rate of emotional abuse increased to 41%. Emotional abuse often accompanies other forms of child maltreatment and, in fact, may be one of the most common forms. Nonetheless, it is very uncommon for emotional abuse to be the sole reason for reporting to child services or to family advocacy. Neglect is the most common form of child maltreatment in the military. The analysis conducted by Fullerton and colleagues lends merit to this argument. Fullerton studied child neglect in Army families, asserting the rates of child neglect have increased substantially in recent years. For many military families, understanding neglect remains complex because of these families' unique circumstances. In order to understand these circumstances, one must understand military family demographics, stressors, and protective factors. Military families share many similar demographics to the civilian population. Nonetheless, certain demographics of military families differ. On average, military personnel marry and have children at a younger age when compared to the civilian population. Among junior enlisted personnel, 36% of men and 37% of women are married. It is estimated that 75% of all military children are younger than 11 years of age. In the Marine Corps, 47% of children in these families are preschool age. Within military families, there are often similar struggles common to all families. That is, they have concerns over education, parenting, child care, and career choices. However, military families have additional stressors. There are frequent relocations, including international moves, which lead to isolation from extended families. Additionally, there are separations other than those related to deployments, such as field training exercises, and then there is the stress associated with wartime deployments. Military personnel returning from combat deployments have pervasive rates of trauma and other mental health conditions, such as PTSD, depression, traumatic brain injury, and substance abuse. Many of these stressors contribute to domestic violence and child maltreatment. Domestic violence and child maltreatment. It is believed domestic violence and child maltreatment often coexist within the same families, with estimates varying from 30 to 60%. In Army families, child maltreatment occurs twice as often in families with a history of domestic violence. Domestic violence and alcohol abuse are more extensive in military families than in civilian populations. Alcohol abuse correlates strongly with domestic violence, which in turn is associated with child maltreatment. Deployment and child maltreatment. Deployment is also related to child maltreatment. An estimated 2 million children have been affected by deployments to Iraq and Afghanistan. Military families are accustomed to separation, but wartime deployments add the dimension of danger, uncertainty, and prolonged separation. The non-deployed spouse and children often experience distress related to the disruption of family life and concern over the service member. It is not uncommon for the non-deployed spouse to report worry and depression during a deployment. As a result, this may hinder his or her ability to care for one and the children. Similarly, children report increased rates of stress, anxiety, behavior problems, and depression during deployment. During 2001, the rates of substantiated child abuse and neglect were lower than those reported in the civilian population. Since 9/11, studies report that the rates of substantiated child abuse and neglect are rapidly increasing. Between 2010 and 2012, the rates of child abuse and neglect soared by 40% in the Army. The Air Force reports a 25% increase in child abuse and neglect rates from 2008 to 2012. In the Navy, child abuse rates remained relatively steady between 2009 and 2011, but the rates climbed through the first half of 2013. Several unique protective factors in military families reduce the incidence of family violence and child maltreatment. When compared to civilian populations, the military has lower rates of illicit drug use, which is estimated at 3% versus 12% in the civilian population. Additionally, more than 90% of military families consist of two-parent families versus only 67% in civilian populations. Moreover, the military provides steady, full-time employment for at least one parent in the home. With this stable environment, service members are allocated housing allowances, medical and dental benefits, and entitlements for food and cost of living adjustments based on geographical location. In many instances, service members qualify for affordable on-post or on-base housing, which also reduces living expenses. The military also provides educational opportunities by offering the GI Bill and tuition assistance. Additionally, there are educational opportunities afforded to spouses and children. The military also provides its family with a strong sense of community and social support network. It also has multiple family programs which help with education and assisting families during times of crisis. Recognizing and reporting child maltreatment. Child maltreatment prevention programs ideally want to intervene before the abuse and neglect has occurred. One can reasonably argue then recognition of child maltreatment is imperative to any prevention program. Recognition of child maltreatment promotes child safety, health, and welfare by reducing the likelihood of further abuse. Recognition also prevents the long-term health and social consequences attributed by abuse and neglect. Therefore, professionals who work with families all have a role to play in recognizing child maltreatment. Achievement of this goal relies on professionals, in this case senior military leaders, recognizing the warning signs which indicate soldiers and their families need assistance, Recognizing child maltreatment requires education and special training by senior military leaders, which utilizes the best and most up-to-date evidence. Please take the time to become familiar with the definitions and indicators of child maltreatment, as well as the military demographics and stressors presented. It is important to note the presence of any of these signs may be serious indicators of child maltreatment, and a person noticing these symptoms should pay particular attention to a child who exhibits them. These behaviors are not, in and of themselves, conclusive evidence that a child has been abused. However, the presence of any of these behaviors may indicate that a child is being or has been abused or neglected. Reporting child maltreatment. Mandatory reporting statutes exist in all 50 states, the District of Columbia, and United States territories. Overall, these laws require designated professionals report actual and suspected cases of child maltreatment to Child Protective Services or law enforcement. The military advocates for reporting child maltreatment. According to Army Regulation 608-18, every soldier, employee, and member of the military community should be encouraged to report information about known or suspected cases of spouse and child abuse to the Family Advocacy Program or the appropriate law enforcement agency as soon as the information is received. Those mandated to report include commanders, law enforcement personnel, healthcare providers, social workers, school workers, and child and youth services personnel. Despite mandated reporting laws, child maltreatment remains underreported. The reasons for underreporting vary. Research suggests a multitude of reasons for failure to report child abuse and neglect, including failure in recognizing the abuse or neglect, lack of understanding in reporting procedures, negative consequences for the family, negative attitudes towards family advocacy or child services, fear of personal or legal retaliation, including making a false report, fear of doing more harm than good, and fear of ruining a professional relationship. It's important to note that child maltreatment or suspected child maltreatment can be reported using the following channels: by calling the military police or 911, by contacting the Installation Family Advocacy Program or local civilian CPS, by contacting your state's child abuse reporting hotline or contacting Child Help at 1-800-4-A-CHILD. It's also important to note that each installation that supports military families has a family advocacy point of contact to receive calls concerning the safety and welfare of children. What is the senior leader's role and legal implications? Commanders and other leaders are required to report child maltreatment, to seek help for all parties involved, and to help ensure safety to the fullest extent possible. Commanders can provide a great deal of effective help, including documenting the abuse, preferring charges, helping with securing a military protective order to ensure the victim is safe, and ordering the soldier to treatment. The role of the senior military leader in child maltreatment recognition and reporting. Multiple factors place military families at risk for child maltreatment, including combat deployments, isolation from extended family, frequent relocations, young parental age, young child age, high rates of alcohol abuse, and high rates of domestic violence. Senior leaders are in a unique position because they possess an understanding of the stressors unique to the military lifestyle. Additionally, senior military leaders are responsible for their command climate and the welfare of their service members, making this program crucial to the well-being of service members and their families. As a top-down organization, one can reasonably argue if child maltreatment recognition and reporting becomes a significant issue for the senior leaders, then it will become just as important to the service members within their organization. Final thoughts. A report of child abuse is made every 10 seconds. Nearly 5 children die each day from child maltreatment. 30% of abused children will go on to abuse their own, continuing the cycle of violence. You may be the child's only hope. If you suspect a child is being abused, please report it. I will close the presentation by saying, General Ray Odierno, the 38th Chief of Staff of the Army, states, The strength of our nation is our army. The strength of our army is our soldiers. The strength of our soldiers is our families. President Obama has made strengthening military families a top national security policy, asserting the health of the military family serves as a strong indicator of the overall health of the military force. I would like to add, the strength of our families is in our children. Thank you for your time.